Hi all, myself Beno Paul from SNS College of Physiotherapy. Today, this class stroke can be learned by DT base. So now today we can discuss about the what is stroke and what are the causes and clinical features and management. So first we can started from the Vaishnavi.
Good morning. Today I'm going to tell about the definition and causes of the stroke. Stroke is a sudden loss of blood supply to the brain is blocked or interrupted, and this is caused by the aneurysm, diabetics, obesity, and hypertension, aneurysm, thrombosis, embolism, and this is the major causes of the leading to the
Leading to the blood vessels present in the brain.
Good morning, sir. I am going to say about stroke types. There are two types of stroke: ischemic stroke and hemorrhagic stroke, sir. Ischemic stroke it is caused in 85% of cases. Ischemic stroke refers to the reduced blood flow to the part of the brain, sir. It further divided into two types: thrombotic stroke and embolic stroke, sir. Next, the second type is hemorrhagic stroke. It is formed in 15% of cases. Hemorrhagic stroke refers to the rupture of blood vessels in the brain. It is further divided into intracranial stroke and subarachnoid stroke, sir.
Good morning, sir. I am Hari Prasad. Now I am going to tell about the clinical manifestations of stroke. According to the types of stroke syndrome, the clinical manifestation varies. Some of the general clinical manifestations are sudden onset of neurological symptoms, then contralateral side affection, then conscious will get lost, then speech and language problems occurs, visual disturbances and cognitive and perceptual impairments occurs, then emotional changes like depression, anxiety, that and all occurs. Then in motor side, according to the severity, it will goes to hemiparesis or paresis or paralysis. Then facial drop occurs. Then spasticity develops. Then loss of motor control and they will difficulty in walking will get occur. Then in sensory part, temperature, pain, loss will occur.
Hello, sir. This is Akash. Now I am going to tell the PT management for stroke. In the acute stages, for first few days, we should give positioning for the patients to reduce the pressure shows. And in ICU patients, we should monitor the circulatory and respiratory functions, so that we should remove the secretions in the lungs by positioning and by chest physiotherapy. And next, in the next phase, post acute phases, we should give the strengthening exercises and the stretching for flexibility of joints, PNF, and for sensory functions, stroking, we should give. After that, we want to move to gait training and coordination and balance training exercise like Frankel and using the wabble board. For the strengthening exercises, below range of motion is below 3 minutes, we should go for suspension therapy. If it is more than 3 months, we can go for active resisted exercises and or active exercises.
Okay, so today we can discuss about these strokes. So in these strokes we have two types. So mainly commonly affected the mainly common type is ischemic stroke. So we have mainly seen anterior cerebral artery syndromes. So stroke present in the anterior cerebral artery, and also PCA syndrome, that is a posterior cerebral artery syndrome, and MCA syndrome. So middle cerebral artery syndrome. So most commonly a stroke can affected or ischemic stroke affected in the middle cerebral artery. So what are the supplies? Middle cerebral artery, where are the supply in the brain? So mainly in the frontal, parietal and temporal lobe. So we have more places of, supplied by the MCA, so middle cerebral artery. So most commonly seen MCA stroke only in nowadays in the worldwide. Okay, thank you.